Hello, Facebook Live. It's November 15th, I think.
17th.
17th. Oh my God, it went fast. Yes, today's going to be a great show. We got some new information on the COVID. What you can do if, God forbid, you should get ill. What you need to ask your doctor. You want to make sure that they can provide you with home care treatment if you were to test positive and you have a comorbidity. I've got the information right here in front of me. This is no joke. And of course, we're going to talk about laser-assisted weight loss as per the Slimbodylaserspa. Full of vim, vigor, and vitality today. This is going to be a really good show. So tell your friends, call up.
This is full.
Any reproduction or retransmission of this broadcast is strictly prohibited without written consent of WSTU. The phone lines are open. Call in with your questions and comments at 220-9788. That's 220-WSTU. It's time for Stuart Laser Talk with your host, Dr. Treds Slim Body.
I wonder why it was there.
I'm 5'10" and 242 pounds.
I always say this is the biggest I'm ever going to be, and I said that 20 pounds ago.
They're obese and they're overweight.
Obesity is the biggest threat to the health, welfare, and future of this country.
I've always been overweight.
I've got diabetes.
Sleep apnea, heart disease.
Everything's hurting now.
It's a lot easier to lose weight than it is to keep weight off.
This is probably going to be the first generation of children who are going to have a shorter life expectancy than their parents.
18% of our children right now are obese.
It's not only health, it's about survival and well-being of the United States as a nation.
You don't crave broccoli, and our generation has grown up craving a Big Mac. I want to think that there's something better for me.
Unless we're able to control this epidemic, we're going to have an abundance of chronic disease.
All of us have to be part of the solution to reduce obesity.
The way the nation is out of control, but we can fix that.
If we don't now take this as a really urgent national priority, we are all going to pay a really serious price.
Obesity will crush the United States in oblivion.
Good morning. The laser lipo revolution is here. You can lose fat the laser easy way at my Slim Body Laser Spa, located on at 2311 Southeast Ocean Boulevard, Stuart, Florida, right across the street from the Fresh Market at the intersection of Monterey Road and East Ocean Boulevard. I'm offering free consultations to anybody that would like to come in and find out about it. You can lose weight, you can body sculpt, you can slim and trim fat deposits, areas you're unhappy with. We can also help you with nutrition. We use whole body vibration, detoxification. This is a full program that can help restore your health, your vitality, your energy levels, and give you some really great friends. Yeah, we've been there now for going on 11 years. This next year will be our 11th year. Over 5,500 clients have been in to see us, and as a result of that, we have a great a great bunch of people that come in there regularly, and it's social, it's fun, it's safe, and it's just been wonderful. I find myself wondering why I can't have a little room in the back where I can just sleep in there and never leave. I love it that much. I want to give a shout out to Mr. Berry, Mr. Frank Berry, and also my friend Smith, Mr. Smith. I know he listens to it all the time with his wife, just signed up. I'm sorry, Mrs. Jones. And just all the wonderful people that support the show. It's just been great. Hey, listen, today is, of course, I'm going to go over brief topics about how the laser works and what I do at the office, in case this is the first time you've ever heard it. But what has really, really been important right now is this COVID-19, and all of the news about infection rates going up and the dark winter that's coming. And You know, it's something that, you know, we're into about 8 months now since we first found out about it back in February. And there's a lot more information that we have about COVID and what to do, and very little, though, on how to prevent it. I mean, they're not really giving you, you know, it's something that I believe is unpreventable. You know, viruses are very, very small particles, and the way that they're transmitted can be either on things, touching things, being close to people. You know, there's so many ways that this spreads around. Viruses have their own kingdom in our world, just like the bacterial kingdom and the animal kingdom and the human kingdom. There's the viral kingdom, and these are not going away. Viruses have been in our world since the beginning of time. In fact, some of the earliest what we know about our planet when it first formed, it was all you know, most of what was the life that was here were viral and bacterial. And there was a battle between the two of them. You know, the viral world. Right now, if you were to take a tablespoon of seawater right from our beautiful clean ocean out here and have it analyzed, there's like 200 million viruses in it. Marine viruses are more plentiful than any other virus out there. And there's viruses that affect marine life, and there's viruses that affect plant life, and also viruses that affect animals. And there's viruses that also affect people, but when an animal virus crosses over from an animal into a human, such as what happened with the bats, and many other ways, we don't really have an immunity to them. We're not used to it. We haven't been, they're called new, meaning novel, new viruses. But within your body is this incredible ability to help itself, to defend itself. You know, it was perfected over millions and millions of years through, you know, just through trial and error. And we are the crowning creation. It's the most organized structure, cellular life that we have on the planet. And we have all of those immunities and all of those defenses and all of the ability to literally live in harmony with bacteria and viruses. We live in harmony. In fact, many of them help us. They're not all bad. And, you know, so this COVID-19, which is SARS-2 COVID-19, is a virus which is well known to us. We've known a lot about coronaviruses for many, many years. We've studied coronaviruses. We know that they're most likely a human, they affect humans more than animals. So we've spent a lot of time and effort, which is what was definitely going on in China. In the Wuhan lab, they were studying coronaviruses, according to the story that we're getting, to help with chickens, to not, you know, because chickens are affected by the coronavirus. So this lab was a way that they were determining safety and efficacy and treatments for it. Why it was in China, I don't understand that. You know, and then there's some people that actually believe that it was created as a bioweapon. Either way, I don't have an opinion on that, but it's something that we're having to deal with today. And if you don't think that COVID is real, you know, you're not in the hospital situations, you're not there watching this happening. But it's not the same as an influenza virus or a cold virus. And I think that that's, you know, abundantly clear. However, the way viruses are transmitted, the way that we breathe them in, and the way that we pick them up on dirty things and people sneezing on you, that doesn't change whether it's COVID, a cold, or influenza, or God forbid tuberculosis, or even HIV. You know, they've proven HIV is bloodborne, but, you know, who knows? So we have to be smart about how we handle these things. Now, there is a paper here which I'm going to go over, because I don't want you to think that I'm coming up with this information all on my own. I do a lot of research and I study it. And there is what's happening is, when it comes to COVID and the treatment of it, there's really two main bodies of thought. two authorities fighting for your compliance, your attention, what you believe to be truthful and fair. And, you know, one of the issues that has happened is the treatment, you know, when somebody is sick and they're needing help from a doctor, you know, the medical doctor is the one who, or doctors that are trained physicians like me, we make decisions based on our knowledge, what we know about, what we've learned in school, what we learned from each other, and what we've practiced. That's why we call it a practice. And fortunately, everybody that comes in to a health practitioner who's not feeling well and has a certain condition, they all come in with skills, with a set of pre-existing conditions or helpful situations, you know, immunities, genetic strength. Some are healthier than others. Some have better habits, food. Some people like to exercise, some don't. So, you know, if you take millions of people and put them into a situation where they've been infected with something, each and every one of those people are going to have different skills that they come in with. So the treatment for one person who's maybe has neglected their health, you know, they have what they call comorbidities, their treatment and their protocol has to be different than the person who comes in that is very healthy, that doesn't have a lot of body fat, who has no comorbidities, who lives in the fresh air. These people are not going to need the same treatment as somebody who has been sickened and has been ill for a long time. And that only makes sense, right? Am I, you know, if I made you into a doctor this week, and I said, okay, I need you to be a doctor, and let's bring in, I'm going to give you 10 different people to work on. You know, 3 of them that are going to come in out of the 10 will be near dead because they're so unhealthy. And they're going to need a lot of help. And then there's the ones that need a little bit of help, and then there's 2 or 3 that really just needed to hear from you that they're going to be okay. Right? And this is a really, really important thing to grab onto, you guys. That, you know, if there's an old saying that if the only tool you have is a hammer, then every problem you see is a nail. Right? If only tool you have is a hammer, then everything is a nail, because that's the only tool you got. And if the only tool you have is a vaccination, a vaccine, then everybody's going to need a vaccine, right? Yet we know from human experience that for some people, a vaccine is not a good idea. And for others, it's critically important. So, and that depends on how the vaccine affects you and your own health and whether you're going to have a reaction from it. There's many, many people that have had vaccines that have had, you know, inflammatory anaphylactic shock reactions, and they are precluded from ever having vaccines. And then there's people that are really healthy that are much less of a risk of dying if infected with something, and they might not need the same vaccine. But then there's other people that are, you know, elderly and older with comorbidities that really do need a vaccine. And I think that that should be the parameter that we look at whether or not we are going to take this COVID vaccine, which is coming. You know, you really need to look at it yourself, yet what's changing is the reasoning, the rationale behind it is they want you to have the vaccine to protect other people. So you have in some way not a carrier, not a spreader. And that changes the whole ball of wax. Because now, you know, we got 7.3 billion people on the planet. And, you know, if they're saying that everybody has to be inoculated to prevent the spread of COVID, or they'd love to be able to do that, to me, that's a really weak case. You know, we got all these people with different immune systems and different habits, and they live in different areas, and some are susceptible, some aren't. And to think that you can blanket everybody with the same, you know, the same problem, the same pill, I think is it's wrong to do that to people. So, you're going to have this challenge pretty soon, whether or not you're going to do this vaccine, and, you really need to speak to your doctor, and also people that are not necessarily have interests in you getting the vaccine, such as, manufacturers and drug companies and governments and governors and, politicians and people, because their reasoning behind it is very different than why you would do it. And that's all I'm going to say about that. It's a personal thing. Whether you got the flu vaccine or not, I think it's personal. But now, with this fear of having COVID, now they're starting to really scare us about everybody's going to have this vaccine. And to me, I have a solution for COVID. I don't have the solution. Our wonderful, amazing medical doctors, nurses, all around the world have been scrambling in the last 8 months to try to figure out what to do about COVID. How do we help these people? Now, we know that COVID is a virus which doesn't really show symptoms for several days, according to their research. That you can be exposed to COVID or any virus, and have 3 or 4 or 5 days where you're asymptomatic. And that means that you're not showing symptoms, but you could be spreading, you might be replicating the virus, but not have any symptoms. And that's a really scary thing, and that does happen. It happens with all the viruses, by the way, not just COVID. You can have the cold virus and not know you have it, and you can make people sick in your home, just like you can with the flu. But the problem with the flu and the cold versus COVID is the flu and the cold are not as virulent. They don't seem to create as many health issues as the COVID does. So what they're starting to find out is that, and I'll summarize this really quickly here so you understand what I'm talking about. There is the way that they treat COVID and the way that they treat these things seems to be a wait, if you get infected, to wait and see. And I'm going to read this directly from what this paper says. So here it says out in the very beginning, if you get COVID-19, you don't want to be admitted to the hospital. So if you get COVID-19, you don't want to be admitted to the hospital. The death rate for patients sick enough to be admitted is quite high, and we know that. And you will probably be a prisoner with no visits from family, clergy, or the doctor of your choice. That's right. When you go in, and if you have COVID in the hospital, they isolate you, and there's many, many records of people that have never even seen their family again. That is sad, and I don't ever want anyone to have to go through that. There's never been any illness that they don't allow people to at least say goodbye to someone or tell them they love them. They could wrap them in a plastic suit, for crying out loud. But when it comes to this COVID, they're not doing this. So that really, really should concern you. And that raises the death rate. I mean, you're alone. You're in this room. It's fear. Oh, my God. So anyway, right now, the standard is doctors mainly provide nothing besides an order to get a test. They order the test. And then they give you advice on when to go to the emergency room. They are told by their employer or their medical society or public health officials that there is nothing they can do. But actually, home therapy could prevent thousands of hospitalizations and deaths, according to a just published article from the respected American Journal of Medicine. The lead author, a Dr. Peter McCullough, who's an MD, a cardiologist at Baylor University, is one of the most widely published physicians in America. Young, healthy patients will probably do fine with watchful waiting and self-quarantine. But according to these doctors, and there's hundreds of them that have signed on to this, thousands of them, patients over the age of 50 or who have other risk factors or worsening symptoms should get immediate treatment with zinc and antivirals. Kind of what Trump did. tested positive. Well, he had symptoms. He tested positive, and right away they got him on the antivirals and the immediate treatment with zinc, antivirals, and the prednisone to help him with breathing. In other words, they treated his symptoms so it wouldn't go into a full-blown hospitalization. The protocol by Dr. McCullough and colleagues began providing in the beginning fresh air to prevent reinoculation. Zinc lozenges or zinc sulfate, 220 milligrams, and vitamin D3 at 5,000 IUs. Immediately, that's the first thing they do. They also list hydroxychloroquine, HCQ, with azithromycin or doxycycline, which are antiviral drugs. And these are for respiratory symptoms. It suggests prednisone, and for suspected blood clotting, aspirin and or blood thinners. They suggest prevention of self-reinoculation with viruses in the breath by providing fresh air, open windows, fans, or spending time outdoors without face coverings away from others. And these are for people that would just be tested positive regardless if they're symptomatic or not. And this would be the 2-week waiting period. And if you have symptoms, they want you to do this early care, home care, right away. Other doctors report success with a drug called ivermectin, which is an antiparasitic agent used for scabies or head lice, or inhaled budesonide or Pulmicort together with zinc and clarithromycin. Definitive randomized controlled trials are not yet available, and colleagues emphasize the need for management guidance. So, to counter the official word from the AMA and others, they're saying no home treatment, just wait for the promised vaccine. I mean, that's really the standard. The AMA, the CDC, the National Institutes of Health are telling you no home treatment, wait for the promised vaccine. If you're, stay home and isolate. If it gets worse, go to the hospital. And when you bring in this home care remedies with your doctor's advice, of course, they're saying that your chance of being hospitalized are down around 1% to 2% if they address it within the first 3 days of knowing you're infected. So you need to call your doctor. You need to ask whether they are willing to read this paper or other studies about patient treatment with hydrochloroquine and willing to prescribe for you if you get sick. It is important to have patients who are trusted physicians share their views. So, in this is a paper with the National Institutes of Health, and it's available on my website, Dr. Treds Slim Body Laser Spa, and you go to the very back, and it's under SARS COVID-19 patient resources, and I put a copy of this article from the American Journal of Medicine, which talks about the basis and rationale for early outpatient treatment if you, God forbid, should be infected with SARS or COVID-2. Now, the best way that I can describe this, because when I first heard about this, and I knew that HCQ was being used, but everybody sees the controversy, and they had the doctors at the White House that were out there talking about it, and then they said that they were all a bunch of witch doctors, and it really makes you wonder why it is only America is this an issue for us. Most other countries, you can get these medications without any problem at all. So I called my own doctor, and I asked him what's their plan. What happens if I was to call you up and say, hey, I got COVID? What would you do? Now, they were very clear that if it was a negative, if it was a test and I had no symptom, they wouldn't do anything. They would suggest staying home and quarantining for 2 weeks. That's what he said. I said, what if I had a symptom? He said, well, it depends on how severe it is, if it's just a mild fever, you know, these kinds of things, he said most doctors will tell you to just ride it out like you would a cold. You know, drink some fluids, get some rest, stay indoors. Man, that's a bad recommendation, because this is an acute respiratory syndrome. This is called SARS. The definition of SARS is sudden acute respiratory syndrome. And that means it comes sudden. So you might find out you're test positive, you go home without a symptom, and then the fear, the realization that you're testing positive, and you start, you know, oh my God, I'm noticing a little temperature, I'm feeling a little dizzy, you know, it's scary. And then all of a sudden, you know, maybe you get a little low-grade fever, and you're waiting a day to see if it passes, 3-4 days, and it's not getting better. And, you know, you're taking chicken soup, you're drinking fluids, maybe one of your friends came and gave you some vitamin C, which is a good idea, and all of a sudden, it's like, I can't hardly breathe, it's on my chest. You know, I'm really in trouble. And then you call you go to the hospital. And your chances of getting through that situation are like, you know, I mean, it's not really great. Once you're sick enough to go in the hospital, they really deal with emergency problems. They're not doing these other treatments beforehand. And that, to me, is common in America. It's not common anywhere else in the world. So I asked my doctor what he would do, and he said, if you were to test positive and you were going to stay home, I would write you a prescription for exactly what this paper shows. And I said, you mean the HCQ? And he says, yes, it's called Plaquenil, hydrochloroquine, and AZ, you know, erythromycin, and dioxycycline, which is the antiviral and the antibiotic. So here's why this is important. I'm going to try to summarize this here and get on to fat laser, but I really think that we need to understand this, that if you were to be infected with the COVID versus a flu or a cold virus, one of the problems with COVID is it immediately attacks your different systems in your body. It's a lot more severe than just when you get a cold. The COVID seems to attack your organs. It attacks your lungs. It attacks your liver. It attacks your kidneys, your eyes, your nose, and your heart and blood vessels. And this is scary stuff. But in the very early part of somebody being exposed to COVID, when they start to have these systems start to get attacked, we have a lot of drugs and therapeutic agents to help you breathe better, to stop the infections with antibiotics, and to also help with antiviral. You know, we have drugs that are well proven to stop viral shedding, to stop the replication of the virus. And, you know, and then what happens is you really are managing these inflammatory responses. The virus is going to run its course. It's going to go into your cells. It's going to create this inflammation. And after 2 weeks, your body's going to develop an antibody antigen response, and you will be immune to this problem if you make it through those first 2 weeks. And what this paper is telling you is that you want to treat the inflammatory conditions, fever, the breathing problem, the infections which are starting to happen from the COVID. And if you can manage those medically, your chances of surviving are much, much better. And here's the problem. The doctors, most of them, will not administer home medication for you. It's, you know, it's a shame. It's right here in the National Institutes of Health and in the CDC. And I'm looking at these, what they call the 4 pillars of medicine of a pandemic response. The first one is contagion, control of the spread. The second one is early home treatment. And then you have late stage treatment, which is hospitalization. And then eventually vaccination, herd immunity. Yet in America, we are not treating the early home treatment part. And if you don't ask your doctor about this, you're not going to know, because you don't want to be caught like this. Okay, now I have a picture. I'm going to hold it up in front of the camera. These are sample COVID-19 home treatment kits that from other countries around the world, but not in America. So there's one from Brazil. There's one from Brazil, from Mato Grosso. There's another one from, well, there's 3 from Brazil. There's one from El Salvador, Guatemala, and Goa, India. And these home kits, and I'm going to hold them up in front of the camera here, these home kits include antiviral and anti-swelling medications. The exact same thing that your doctor would prescribe here if you were to be at home, if he was open-minded or she was open-minded. They offer them to you at these countries if you're sick. And according to their statistics, these countries, out of 1 million people, have a death rate of like in the 30 or 40 people. America, the death rate for every million is like 600. And people, I don't know why they're not going to allow home care, why they don't practice this, why they're not talking about this. President Trump had it, and you should be able to too. And that's really what it is. So you want to ask your doctor, get on the phone right now, your primary care, and ask them. I'd like to ask a couple questions, 3 questions, and that is what would you do if I was to test positive with COVID? What is your policy? Do I stay home? Do I wait? Do I go to the hospital? What do you want me to do? Number 2 is, I've tested positive and I'm having symptoms. I'm having some temperature, some fever, some diarrhea, mild symptoms. What would you want me to do? Do I go to urgent care? Do I go to the hospital? Or will you prescribe me the home remedies so I can do it at home? And they can have oxygen at your house in 3 hours. And a pulsometer so you can start breathing better. They can drop ship the erythromycin and the dioxycycline within 2 hours to you. And also the HCQ. You're allowed to prescribe it. Or are they going to tell you to wait, and if it gets worse, to go to the hospital? I'm going to go for the home care personally. I really believe that at this point, you have to make that decision on your own. The system is not in your favor. Time is not your friend. I know they mean well, but there's definitely a political, governmental, medical, legal, pharmaceutical interest in I don't know why they're not addressing this. So that's all I'm going to say about it. I love you a lot. I hope I didn't scare anybody, but if you'd like more information, you can email me, slimbodylaserspa@gmail.com. I've got the article right here, the pathophysiological response. I think everything is actually in reverse on this camera, so it's probably not doing you any good. But it's on the National Institutes of Health, and you can type in pathophysiological basis and rationale for early outpatient treatment of SARS-CoV-2, COVID-19. And this is a brand new paper, everybody. All right.